Most of these particles are carbon-based, but there were also traces of metals including silica, phosphorus, calcium, iron, chromium, and even titanium and zinc. Many of these materials can originate from the combustion of fossil fuels and additives in fuel and oil. Exposure to these particles can have negative health effects, including brain, heart, and lung damage. For expecting mothers, exposure to even low levels of air pollution during pregnancy could cause preterm birth or health defects in the child. This study did not verify whether the particulate matter can move to the fetus. However, Luce says if the placenta is damaged, it is likely that the fetus will be indirectly impacted as well. There is an established link between maternal exposure to air pollution and adverse fetal and birth outcomes such as preterm delivery and low birth weight at term, Luce says. This study suggests a potential underlying mechanism of how these are linked. The lungs and airways contain cells called phagocytes that patrol their environment for unwanted substances, and either destroy them or die with them. The research team found the pollutant particles embedded in phagocytes in the placenta. Luce says that it is possible that some of these particles escape the placental phagocytes, which could allow them to move through the placenta and cause harm to the fetus. Since it is unlikely that we can reduce all sources of ambient air pollution, more studies demonstrating protective effects of a diet rich in nutrients and other preventive measures, like use of air cleaning in the homes, are needed. An impaired placenta could result in less transport of nutrients and oxygen and removal of waste from the child, and it could restrict the growth, cause preterm birth and preeclampsia. Marie Pedersen, an associate professor of public health at the University of Copenhagen, tells very well via email. Both prenatal development and pregnancy are life stages of heightened vulnerability towards toxic exposures, Pedersen, who was not affiliated with the study, says. Factors such as exposure to ambient air pollution can have long-term effects on child and maternal health. If a child is born too light or too early, it may impact the function and health of the child throughout life, impacting the child, its family, and our society. Prevention of adverse pregnancy and birth outcomes is therefore very important.